Welcome to my channel Easy Anatomy and Physiology. So today what we are going to discuss. Today's topic is circle of Willis. So very first question comes in our mind that what is circle of Willis? The circle of Willis is an arterial anastomotic circle present in the interpeduncular system. It is polygonal in shape and extends between the superior border of pons and median longitudinal fissure. It is closely related to the optic chiasma, tuberous cinerarium, mammillary bodies, and posterior perforated substance. The arterial circle is an anastomosis between the internal carotid and the vertebrobacillar system of the arteries. Now let's talk about the formation. The anterior communicating artery, which connects the right and left anterior cerebral arteries and forms anterior part of the circle of Willis. The anterior cerebral artery forms the anterolateral part on each side. The lateral part is formed by the termination of internal carotid artery on each side. Posterolaterally, the posterior communicating artery is the connecting link between the internal carotid and posterior cerebral arteries. The circle is completed posteriorly by the bifurcation of basilar artery into the right and left posterior cerebral arteries. Now the functional importance. This arterial circle equalizes the pressure of the blood flow to the two sides of the brain as it is the main collateral channel. The arterial anastomosis provides an alternative route through which blood entering the internal carotid artery or the basilar artery may be distributed to any part of the cerebral hemisphere. Now let's talk about clinical anatomy. Berry aneurysm. Berry aneurysm is localized dilatation of one of the arteries of the circle of Willis due to congenital muscular weakness. The most common site of Berry aneurysm are the junction of anterior cerebral and anterior communicating arteries and the bifurcation of the internal carotid arteries. Rupture of Berry aneurysm may cause life-threatening subarachnoid hemorrhage. The very important thing what we have to remember, that is rupture of Berry aneurysm may cause life-threatening subarachnoid hemorrhage. So we now going into this picture. This is the circle of Willis. You can see there is anterior communicating artery that joins the two anterior cerebral arteries, right? Is it clear, everyone? Okay, I hope it is maybe clear to everyone. Now the anterior cerebral artery forms the anterolateral part. Let me show you. This is the anterior cerebral artery. This is the anterior cerebral artery. Okay. This is the anterior communicating artery which connects the right and left anterior cerebral arteries and forms anterior part of the circle of Willis. So this is the anterior part of the circle of Willis. And now anterior cerebral artery forms the anterolateral part. Okay. And the lateral part is formed by the internal carotid artery. Internal carotid artery forms the lateral part. Now let's talk about the posterolateral part. Posterolateral part is formed by the posterior communicating artery. This is the posterior communicating artery which is the link between internal carotid artery and posterior cerebral artery. This is the posterior cerebral artery. Okay. Now what we're going to do, circle is completed posteriorly by the bifurcation of the basilar artery. This is the, I will show you in a 3D picture there is two basilar artery, the right basilar artery and the left basilar artery.